New restrictions on wearing masks go into effect statewide today as Maryland begins trending in the wrong direction as it relates to COVID-19. There are even questions about whether we need to roll back some of the openings, particularly indoor dining at restaurants and bars. It has become a huge debate. Dr. Wilbur Chen is an adult infectious disease specialist at the University of Maryland School of Medicine and a member of Governor Larry Hogan's COVID-19 response task force. And he's joining us this morning. Good morning.
Hi, good morning.
Okay, so we are so far into this pandemic, and there is still the debate over masks and whether you should wear them or not. So for you, why is it important to wear a mask?
Yeah, it really shouldn't be a debate. Among scientists, I think we're all agreed that these masks are highly effective. What they're trying to do is to block expired breath that might carry these infectious particles. And so every time a group of people are together when wearing masks, whether it's indoors or outdoors, whether it's at a restaurant or at a bar or any other place of business, it's going to be a highly effective means of decreasing transmission events.
You know, a lot of people still resist, and I've heard this comparison. People compare it to wearing seatbelts. You wear them because the government determined that that would be helpful in saving lives. It's not political, and people do it. Is that a fair comparison? Is that fair?
I think so. I think it's also like, you know, when 20 years ago, people debated whether or not secondary smoke was a hazard. And so, you know, people were very resistant to the fact that we stopped allowing smoking indoors at restaurants and within buildings. And now it's really not a debate, but I think at that time it was just a hot topic because a lot of people disagreed with it. Now, the science didn't change. It's basically, and it wasn't really a debate. We knew that secondary smoke was a hazard. It's just, you know, what policies do we need to have in place? Same thing with masking. So now the executive order has been ramped up such that it says, okay, now all businesses must adhere to this mask mandate. Now, we were hoping that people would understand the importance of masks and do it willingly, but now we have to have an executive order to force people to do it.
Doctor, let me ask you this before we run out of time. Let's talk about the indoor dining. A lot of debate again over that, and Baltimore City even rolled back their indoor dining. Is that a place where we are seeing the spread of coronavirus? Is that a concern?
It is a concern because, you know, indoors activities are certainly more hazardous than outdoors activities because the air doesn't move around as much. And so the air exchange means that you might have more, again, contact with the virus from the air. But, you know, you can build things in place so that indoors can be safe, indoors dining, which is having air moved around and having distance built in. So that's a lot of the measures, of course, hand washing and all the other measures that a lot of the restaurants have been employing. But again, if it's not working well because people are not adhering to it very strictly and it just takes one or two people, then that is enough to cause a transmission event. So I think, again, for some locations, dialing back is proper.
All right. Dr. Chen, thank you so much. We're going to have you stick around. Dr. Chen will be back to answer your questions about COVID-19 in just a few minutes. So give us a call with any questions that you might have about coronavirus. That number